Hello, everyone. I'm Adrianne Gerard, a health coach and registered nurse, and today I have the pleasure of introducing Dr. Charles Rouse. Dr. Charles Rouse is a pharmacist, a pharmacologist, and a doctor of natural medicine. He is a formulator as well, and we are pleased to have him here. Welcome, Dr. Rouse.
Hey, Adrian, and it's always special good when I can be around a health coach. And I already know that all the RNs I know, they're just super. I mean, they just come into this profession already super smart. So we appreciate you.
Thank you, Dr. Rouse, and we certainly appreciate you. And so today's topic, Dr. Rouse, is chronic fatigue syndrome and fibromyalgia. Sometimes people say they might be cousins, that kind of thing. A lot of my clients lately are presenting with that, and I thought maybe you could enlighten us.
I'd be happy to. And the name fibromyalgia, fibro like the fiber of the body, myo for muscle, algia meaning pain. Ooh, that can't be fun. And look, fibromyalgia is common. It's in the millions of people. Women, for some reason, 3 out of 4 are women. So women have more problems with fibromyalgia, and usually age 20 to about age 60. So Dr. Charlie's always said, man, this stuff must have a relationship to the hormones, whether it's estrogen or cortisol or thyroid. And when you look at it and you put it all together, fibromyalgia is the pain portion. But some of them, Adrian, they say, I'm so tired even after I try to sleep at night that I don't even feel like getting out of the bed. So chronic fatigue can be a major problem, where pain is the fibro side of it, and fatigue just is from a general malaise. So put it all together. When people have a chronic fatigue syndrome that is related and coming from fibromyalgia, the doctors usually have to listen to the patient, and generally speaking, there'll be a myriad of pain areas in the body. It could be from here to there. Their pain and their aches and their fatigue is, like they say, oh, it's in every muscle. It's not just in my shoulder, it's in my neck. It's all the way down to the shin bone of my leg. And when every joint in the body, from the elbow to the wrist to the fingers to the knees to the hips, hurt, man, oh man. And when that lower back gets out of whack, you can't even get up out of a chair comfortably. And when those things are aggravating, they come along, they say, do I have it? And the doctor says, we really don't have a test. We can't just draw your blood and say you've got it. We can't just send you to an MRI and say, I know it. The truth is, it's more symptomatic, but the real truth is, it's very real, because the ones who have it, it's chronic, and the fatigue level is extreme. Now, what comes along whenever you're hurting and you're trying to rest or sleep in the bed, sleep disruption, major problem. And generally speaking, when we ask our fibromyalgia patients, how do you feel in the morning? They'll say the worst is in the morning. And that's because they haven't been able to get a restful sleep. Sleep disruption is a major problem in fibromyalgia. We know that in chronic fatigue, the syndrome itself is overwhelming. I mean, some people talk about being tired, but I guess the best way to analogy that is say, have you ever seen somebody go out and work in the yard all day long, say for 2 or 3 days straight, and then they're whooped? I mean, they're beat. They're so dog tired and so achy all over. But what's the cause? It's an overreactive immune system. Their immune system is somewhere out of balance. And when things are disproportional, everything that in the joint or the muscle or the ligament or the tendon or the bones get very disruptive. Natural medicine is the only hope that I've seen. I've seen doctors prescribe prescription antidepressants, hoping to get a little better sleep, a little better mood. Does nothing more than just to fatigue them even worse. They come along and say, well, look, you hurt, let me give you a pain pill. No, because the truth is, most of the over-the-counter pain pills have a lot of difficulty for the human body to absorb and assimilate. I mean, even acetaminophen, Tylenol, they talk about it being easy to take. No, that is a chemistry that your body has to detox, and your liver gets even more congested, and it can actually cause the problem to be worse. Ibuprofen is not the answer. If you open up a physician desk reference, that's the book that talks about all the drugs, under ibuprofen, guess what? The PDR says this drug degenerates cartilage. Goodness gracious, my fibromyalgia patient's already having trouble with ligaments, tendons, and cartilage. Why would I ever want it to be more aggravating? As much as it hurts, you need to learn to stretch more, because the stretching is major in fibromyalgia. Even though they're so chronically fatigued, they need to take a step or two more than they're usual to, and to get out of the non-sleep pattern. When people have a non-restorative sleep, their body's going to be very dysfunctional the next day. At Modexus, I was able to formulate a product. We call it Tranquility. Tranquility is unique in that it helps alleviate stress in the body. And when you do that, you lower your cortisol levels, which is one of the hormones that is in conjunction with fibromyalgia. So as we lower the cortisol levels, because the body is taking care of stress, the nice thing about Tranquility is that people can now get a better rejuvenating sleep, something with a rapid eye movement sleep. And the nice thing about it is it's not a drug. It's not addictive. It's not habit forming. You can adjust your dose from 2 capsules to 3 capsules, or even 4 capsules at bedtime. Just let your body tell you how much of Tranquility that you need. And when you get a better sleep, less stress, the old blood pressure is even going to be on the normal side. What causes it? Well, Adrianne, they say that suspect that may be more of a viral infection that somebody just was not to take care of somewhere in their past. Something like an Epstein-Barr virus that can disrupt the immune system patterns. Women are very much more prone to yeast infection like Candida albicans. And whenever these infections are roaring in the body, and lately some of the keynote physicians are looking at it might have been an undiagnosed Lyme disease, where a spirochete of a tick bite got in the blood and caused a lot of things. But this we do know, Adrianne, we know that all of our fibromyalgia patients, because their immune system has been dysfunctional for a while, they're generally going to be much higher in heavy metals, whether it's cadmium, mercury, lead, zinc, any number of metals will cause the pain threshold to be very difficult to manage in fibromyalgia. When we look at our patients, they have a lot of chemical toxicity issues. It could be that the municipal water or the air they breathe or the food they eat, a lot of that stuff is creating chaos. Nutritional deficiency is a major problem in fibromyalgia. So in the Modexus family, the very first product that I formulated and brought to the market for Modexus was an immune system modulator. See, when we have an immune system, we want it to take care of that overreactive, but we also want our underreactive to get back to normal. And nutritional deficiency is it. All fibromyalgia patients, all chronic fatigue patients are all deficient in iodine. They're very deficient in manganese and boron and magnesium and calcium and potassium. And there are about 80 different minerals, 80 different minerals. So no, you don't need to open up 80 different mineral bottles. We solved all of that. In the Modexus Lanacera longevity, we put the best of bioflavonoid-rich foods like the berries, the Lanacera berry and the maquis berry. We undergird it with the world's best immune system modulator. And this modulator is called glutathione, and it goes into every cell of the body, grabs up the toxic issues, drags them out of the body. And even if it were Lyme disease with a spirochete, it's going after each and every one of those things. And when that happens, the body can now acclimate. But because fibromyalgia is an inflammation process, and they're finding that in the inflammatory process, there's two things that are common in every fibromyalgia patient. One is called interleukin 6, IL-6, which, by the way, was what was deadly in the coronavirus. When people were getting inflammation in their lungs and dying, it was because of the IL-6 molecule. And as I mentioned earlier, when their level of cortisol from stress is high, inflammation is magnified. So we built a product called Relieve. It's a gold standard in our Modexus family, RELIEVE, Relieve, that reduces inflammation and pain very sufficiently. But Adrianne, as a nurse, I'd recommend to you with all of your patients with fibromyalgia, we know that in almost 100% of the cases, they are DHEA deficient. And that's something that a simple blood test can tell the doctor. And you know, if the patient is low on DHEA, it's a simple remedy. You can go to a vitamin supplement store, get a DHEA supplement, and take it every day and get it back up in there. We find that in chronic fatigue syndrome patients, that if we'll change their diet more to fruits and vegetables and get them far away from what we call processed and refined foods, just take that out of your diet, things really do change. But that's the basics: chronic fatigue, dog tired, fibromyalgia, hurting in about 10 or more places on the body, all the way from the top of the head to the bottom of the feet. But Modexus is probably the #1 nutritional supplement company in the world that can handle a lot of those issues, because tranquility reduces the stress, improves the sleep. Relieve takes care of a lot of the pain syndrome without a drug. And the good news is that when you bring on Lanacera longevity, you're actually going to the root cause of the whole problem. And then you say, but what have you got for energy, Dr. Charlie? And in chronic fatigue syndrome, we know that 40% of all the energy that the body needs is going to be used by the brain. And so we formulated LIFT, L-I-F-T, which is a brain-enhancing super nutrition for better memory. But the neat thing is it feeds the brain. And when the brain gets fed, the rest of the body comes on up. And I've seen people feel 10 years younger, light years smarter, and a whole lot more energetic just by getting on the Modexus products. Does that sort of answer your questions there, Adrianne?
Oh, and more, I have to tell you. So what I'm hearing is there is actually hope for these patients.
There is. There is. And a change in diet, a simple, slow change, but they've got to be consistent. Adrianne, sometimes they'll go and say, well, I'm going to take me a pain pill to relieve down the goozle, and they feel better. But you know what? That old monster that's hiding in the dark, it'll come out and clobber them. You've got to put it to rest. You've got to be consistent.
In consistency lies the power, right?
Yes, it does. Good way to put it. All right.
Okay, well, everyone, this is so exciting. It's hope for patients who have had none. And so I recommend anyone suffering with chronic fatigue or fibromyalgia, or family members or friends, you must get in touch with the person who shared this with you. And there is hope. Thank you, Dr. Rouse, as always. Until next time, take care.
Okay, let's do it again, quick.
Yes, yes, sir.